So today I want to talk about silicone versus saline implants and how I personally chose between the two. For those of you who don't know, I have saline implants. But going into my initial consultation, I knew 100%, nothing could change my mind, that I wanted to get silicone implants. And that's until my doctor told me the pros and cons of both and basically laid out all the facts for me. I had done my own research before, and I liked the fact that silicone was softer, and I was under the impression that they didn't ripple. And also I had in my mind that silicone was just the better implant and that saline implants were less than, and kind of, I don't know, I remember saying to someone that I don't understand why anybody would ever want to get saline. So it's just funny that I have saline now. But anyway, so the reason why I chose saline over silicone is because I live in the US, and here in the US, silicone implants are not FDA approved, and they've been taken off the market before and put back on just recently in 2006, I believe. So that's only 5 years, and just personally, I don't feel comfortable with that. Something to me that means they're still relatively new. Also, yes, they are softer. Like my doctor let me see and hold both implants. They are a lot softer than saline implants are. But my doctor told me that if you have enough breast tissue pre-op, and if you do it under the muscle, then the texture of the implant wouldn't matter. Not the texture, but you wouldn't feel the softness of the implant anyway, because you would feel your breast tissue first and then your muscle and then the implant, so it wouldn't matter. So on a relatively thin patient or somebody with thin skin or somebody getting them over the muscle, then the softness matter of silicone versus saline would make a difference. But for me, since I had an okay amount of tissue and I was getting it under the muscle, it wouldn't have made a difference in the softness, at least not much. And also, I was under the impression that silicone implants did not ripple, but apparently that's also not true. And there isn't really anything you can do to avoid that with either one, except for with saline, you could overfill the implant, which one of mine is overfilled, but it doesn't feel any harder than the other one. Let me show you if you haven't already seen. So, yes, these are my implants, and I'm only 2 months out. They're saline, and they're really, squishy and pliable, and they're soft right here because this is my natural breast, like all this here. So you don't even feel the implant at all right here. Where you do feel it is down in this area where this is all, I'd never had any breast tissue really because I had tuberous breasts, so I didn't really develop under here. So anyway, so to me, the softness didn't make a difference. Also, he told me that with silicone, the incision that he would have to, I got my incision underneath my armpit, that the incision would have to be like this for silicone versus like this for saline, because with the silicone it's already pre-filled, so it needs a bigger hole to go through, where the saline you just need a tiny slit because you just slide it in there and then they fill it up. Also with saline, you can adjust the fill amount once it's in you, and you can overfill. But with silicone, there is no room for adjustments, and what you pre-order is what you get. Another reason why, this could be a factor for someone else, but it wasn't really for me because, if you're going to be paying for breast implants, I don't think that a difference in price matters, one implant versus the other, because you're already dishing out a bunch of money. My surgery cost me almost $9,100. It cost me $90, $95, and that's with saline implants. If I wanted to get silicone, it would have been, those implants cost $1,500 more. But do you get what I'm saying? Like, if I'm already paying close to $10,000, then an extra $1,500 wouldn't have been much. So, but for some people, that is a factor of why, you know, to go one for the other. But I say don't do that, because then you're going to constantly think, oh, I should have just spent the extra money and got silicone. Okay. Another difference between silicone and saline. Now, this wasn't why I chose, but now that I did, I'm glad that I did. Saline implants offer a more round look. It's like, see how mine are particularly kind of round. You get that with saline breast implants, but silicone implants, you're going to get a more natural look. So it really just depends on the kind of look you're going for. Also, because of the fact that silicone implants are pre-filled, when they insert them, it causes more friction because they're putting a big round implant in a smaller slit. So anytime there's friction, you can cause bacteria. And bacteria can lead to infection, which can lead to something called capsular contracture, which I've gone over in a different video. Basically what that is where your body tries to protect itself from the implant and starts to form scar tissue to kind of block the implant off of the rest of your body. So then you get this really tight ball looking look on your chest. I'll insert a picture. The risk for that is a lot lower, considerably lower with saline. One con to saline, along with the feel of them, if you have thin skin, would be the fact that they can deflate, unlike silicone. Silicone does not deflate, but silicone can rupture. I think people have the misconception of that. So with saline implants, if for some reason it does deflate, you'll wake up one morning and it'll be flat or back down to the normal size. But at least that's the kind of warning to let you know that it has happened. Now and I'm fine with that, because you get a lifetime warranty. Well, if you sign up for it, you get a lifetime warranty of implants, and to me it's not really that big of a deal, and I would like to know if something is wrong in my body, if something's not right. And being that it's just saline solution, it's the same thing that you were to get an IV if you were dehydrated. So your body just pretty much absorbs it into your bloodstream and you pee it out, basically. It's just water, salt water. With silicone, people have the misconception that they don't pop or don't leak, but they can leak, or the silicone particles can get into your bloodstream and your body can't do anything with that. So that would not be good, and there isn't any way to detect a silicone rupture without doing an MRI, and doctors suggest that every 2 or 3 years you do an MRI, and MRIs are expensive. They're like $2,000 or $3,000. So that's also something that I wasn't willing to have to do. When my doctor said this to me, I was confused because, I've seen this video online, and I'm sure if you've done research on YouTube, you've probably seen it too, where the doctor is doing a comparison between silicone and saline implants. He pokes the saline implant, and of course it eventually deflates. But he takes the silicone implant and he cuts it in half, and it remains intact on both sides. Now, I mentioned this to my doctor, and he said that that is not true, and that they do this for marketing. And by marketing, I just want to explain what he meant. This is a still from the video that I'm talking about, by the way. As you can see, the guy has the implant split in half and has the implant is staying intact. So what my doctor was saying was that after about however much time passes, that the silicone would not stay intact in the implant shell, and that it would eventually flow outward. Now, my doctor was, like I said, silicone implants came back on the market in 2006, and my doctor happens to be one of the doctors that pioneered the case study of silicone implants. So, I mean, if the guy that did this whole study is telling me this, of course I'm going to go by what he says. So, silicone implants can leak, and he even showed me a revision that he had to do. He wasn't the original doctor, but he did a revision on a girl who had silicone implants, newer ones, like since 2006. and the mess inside, it was gross, but the mess inside of her chest was pretty gross and pretty hard to clean up, he said, because, you know, silicone is sticky. So it's just something that I don't want to have to deal with at all. So I like the saline. I mean, they're pretty soft to me. They don't feel like real breasts, but even if I had silicone implants, they wouldn't feel like real breasts, because I've talked to plenty of girls with silicone implants, and they don't say they don't feel that way. Like I said, it really just depends on your body type, how much breast tissue you have already, and where you're deciding to place the implant. But for me, it did make difference because I had enough, and I went under muscle. Also, something to keep in mind, though it doesn't really matter because it's not like you don't get charged per cc amount, but just saying, a silicone implant that is 350 cc's is going to be smaller than a saline implant that is 350 cc's. So in other words, you get more bang for your buck, I don't know, by getting saline, because I have 225 and 250 cc's in saline implants, and it got me to the size that it did. I mean, I started off as an A, and now this size that now this bra is a 32 double D, and I've even had some silicone girls just tell me they can't believe that I got this to the size I did with that small amount of cc's, but it's because saline, I guess, feels more volume than silicone does, so I got a bigger result because of that. Okay, so I think that's pretty much everything. Like I said, I'm not telling you one way or the other, I'm just telling you why I chose the way I did. I think the biggest detractor for people is the fact that saline will deflate, but like I said, it's kind of like if you have a car, would you rather have the check engine light come on and you know something's wrong with it, or have it never come on and you think it's fine when it's not, and then one day down the road something major happens, you know what I mean? So, I don't know, that's just how I look at it. But okay, if you have any questions about that, then leave it below and I'll try my best to give some insight on that. But besides that, I guess I'll talk to you ladies soon. Okay? Bye, ladies.